Welcome, everybody, to our 2025 Coffee and Conversation series. And this is our second speaker of the series. We'll be having four speakers this year. And we are very honored to welcome one of our own. So, Yupawadee, I'm going to try your last name, Kantabanlang.
Good.
Okay.
Yes.
Close. Who also goes by O and is probably known by some of you at the School of Nursing at the University of Michigan, is currently a postdoctoral research scholar at the school, working with colleagues related to colon cancer, and is very interested in cancer support and palliative care more generally. O has over 20 years of experience as a nursing educator, and is really committed to addressing research related to cancer support and palliative care. And she joined us is it about a year and a half ago, at the School of Nursing as a postdoctoral research scholar, and has been active in our Office of Global Affairs. She leads a weekly writing seminar for that's really centered around kind of international students, but I think is welcome for anyone to join. So if you're a student and you're interested in joining a writing group, we can connect you with O for that as well. And then I was happy to hear this morning that O will be staying with us next year, working with one of our faculty, Rob Knorrell, on projects related specifically to colorectal cancer. So she'll be telling us a little more today about enhancing colorectal cancer symptom management with digital technology. Lastly, I'll just add, I think this project is really focused on work in the United States, but O is originally from Thailand and is going to speak a little bit to kind of the global impact of some of these technologies and even just managing colorectal cancer symptoms. I also see we've had a few colleagues join while I've been doing the introduction, and I just want to remind colleagues that I do have the closed caption translation on. So if you would like to see the caption language in a different language, you can go to the little arrow by the closed captions and select your language that you would like to see captions in. All right.
Okay.
Oh, I will turn it over to you. We're really excited to hear from you. And if you have questions as O is speaking, feel free to use the chat or Q&A, and then we will have some time for questions and conversations at the end of the presentation.
Okay. Thank you very much, Michelle, for introduction me to everyone. Okay. Good morning, everyone. Again, I'm Yupawadee Kantabanlang. You can call me my nickname O. Today, I would like to talk about enhancing colorectal cancer symptom management with digital technology. I'm a postdoctoral research scholar. Actually, I am participate in my mentor project, but I have to plan about my next year's project that focus on the symptom management. So today I would like to talk a bit about I will start first with because it's an informal. Someone is didn't know me before, so I need to tell. It's like I'm from Thailand. I graduate from bachelor degree and master degree from Thailand in the southern part of Thailand, and I have a chance to uh, graduate a PhD from the United Kingdom from the University of Nottingham long time ago, around 2014. And area of my research interest is about the social adjustment among cancer survival and family caregiver. And also I will focus on about the end of life communication and advanced care planning and pain and symptom management. And outline for today, I will talk a bit about for our understanding about cancer and symptom management linked to the digital technology. And then I will focus on my scoping review that I have been done already and right now is under review for the journal. It's AI and colorectal cancer. And also for my future plan in the next academic year, in a research protocol that I have already planned for uh, the next year, and then I will summarize for the key consideration for the global user after someone will need to use the AI integrate in the health in the future. Okay, I will start with the global colorectal cancer statistic. As everyone know right now, is colorectal cancer is rising. Now is for the last and update cancer statistic is approximately 1.9 million new cases of colorectal cancer diagnosed annually worldwide. And actually, right now is it's become a second leading cause of cancer-related death globally. And by 2040, the global burden of colorectal cancer is expected to rise to 3.2 million new cases and 1.6 million deaths annually, driven by population growth and aging. And the trend in younger adults is very interesting. It's right now is colorectal cancer incidence among individuals under 50 years old in 27 out of 50 countries analyzed, including the United States, Australia, and several European nations, including Thailand as well. Right now is a young adults is diagnosed with the colorectal cancer increasing. The importance of symptom management, why we are interested in symptom management in this group of population, because the enhancing quality of life, effective symptom management address common issue like fatigue is the number one of the symptom, and then the bowel dysfunction that impact for the gastrointestinal system for the patients, and insomnia, which persist even after treatment, and thereby improving patient daily function and well-being. I think for the important one, the other one is reducing psychological distress. The symptom actually like pain or fatigue can help about the psychological burden for patients. And then for the depression and anxiety as well. So for the symptom management, it might be help the patient to have uh, the psychological well-being amongst their disease, the journey. And then to improving treatment outcome as well, and early and effective symptom management can lead to better adherence to treatment regimen and potentially improve survival rate for the population. And the digital health technology, as everyone know already right now, is the digital technology in health refer to use of the electronic tools, system, devices, and resources to generate, store, or process health data and enhance the delivery of healthcare services. Normally, it's aimed for use the digital health to improve access to the care system and increase efficiency and quality of care, and support personalized and preventive medicine, and empower patients to manage their health by their own. It's like a self-management to encourage them to manage. Sorry, why it's not going? Okay. And also for the real-time monitoring, and patient can log symptoms daily using mobile app or wearable devices. And healthcare provider can track trend and respond early to worsening condition. And also prevent symptom escalation that lead to emergency or ER visit or hospitalization. And also the best thing is improve communication, especially for the young adults. Sometimes they are very difficult to explain about the experience of symptoms. So the digital platform or patient portal chatbot can enable to continue patient provider dialogue. And also for the communication, they can support about the shared decision making and empower the patient to manage symptoms proactively. And personalized care, AI can analyze symptom pattern and tailor intervention. For example, for the medication or the chemotherapy in terms of the oral agent, cancer dose adjustment is very important. And also for the referrals as well, and help deliver just-in-time intervention, especially in the palliative and supportive care. And data-driven insight. Accurate symptom data help identify population level trend. We can know about that and inform clinical guideline research and quality improvement also. And enhance access and equality is a very important point, especially for the uh, country under development. We need to try to treat people equally, and remote symptom monitoring, extend care to the rural area, underserved populations, and reduce travel burden for frequent in-person visit. It's safe about the cost as well for the people to go to the hospital. And for example, in the colorectal right now, we have the mobile app that cancer support allow patients to track pain, fatigue, GI issue, and mood. And also AI can power system like analyze patient report outcome to predict symptom exacerbations and tech-based check-in that remind patient to report symptom and take medication. Is very nice right now that the AI can help patient too much. And for me, right now, I very interested in AI because AI is a power to analyze and can predict about the symptom. It's like a triage for the worsening symptom in the future that the clinician can know before and can prevent, give them about the recommendation before the symptom get worsens. So I think AI right now is can perform tasks require human intelligence. Is maybe include about the learning, can analyzing data pattern, and can make a decision and prediction and problem solving, and understand about the natural language is very important to use about the natural language processing to integrate in the caring system for the cancer patients and recognize about the image and speed of the patients. And then this year, I will start to review about the AI and colorectal cancer, and I try to use the frameworks about the cancer supportive care framework to see about how AI can help about the colorectal cancer supportive care, that you can see about the framework from the Margaret Fit from Canada, and she already developed about the multi-dimension for the cancer patients that need to support from us, like a clinicians or a healthcare provider. You can see in the physical pain, nausea, vomiting, fatigue, emotional, anger, fear, hopelessness, or something, and maybe the information that the patient need to know. So I am have a scoping review, try to know about the all the dimension have already addressed and AI have already involved or not. And I have the analysis I can find from the review from the 1,658 article, and I use the eligible criteria to select about the 29 that include in the final analysis, and the result we can see about the AI and colorectal cancer that we know about right now is the AI application for the colorectal supportive care will focus on a predictive model. A predictive model to provide the informal information support. For example, normally they use about the patient's history and about the patient's medical record, try to correct the data and then used to in the system for predictive model, particularly in terms of the side effect or complication associated with the surgical treatment. From the 29 studies, around 15 studies is talk about the complication associated with the surgical treatment. And then I can find the use of AI for physical support in symptom management and emotional support during cancer treatment is a limitation in this area. It might need about to further develop about the symptom management or emotional support. For example, it's like to generate AI for track symptom and two-way communication between clinician and patient to know and then to evaluate about the emotional during the treatment and beyond. So it's very important to go to this point in the future. And this is about the review. It's like I show you in the percent. It's like a physical support. It mean about like a symptom management in the main. It's like a little bit. We can see that. And then for the mostly it's like the yellow one is information support. It's like already I already talked about the normally they use for the data from the patients to predict about the complication of the patient. And then for the gray one is post-surgery complication. It's a lot. Normally is the person who uh, under going the project or conduct the research is normally is the medical medicine, the physicians rather than nurse. And then I think for the physical support is about the nurse professional role need to involve, try to use and integrate AI to support our care. And then for the conclusion, for my scoping review in the colorectal cancer and AI, we can see about the information support and gap in the psychological, social, spiritual, and practical support we need to address in the future. And implementing AI technology offer an opportunity to enhance supportive care for patients with colorectal cancer. And more study are need to develop effective AI-driven tool for supportive care in cancer to improve patient outcome. Because right now it's like sometimes we need to develop about the how I can say it's like for the cycle, the next cycle for develop for the validation or about the stability of the AI to use in the next future. And then after I already review and we know about the gap of the uh, uh, knowledge at the uh, to date. So I will do about the empowering adolescent and young adult because it's not too much about the research in area of adolescent and young adult cancer survival through AI and for the real-time symptom treatment and support. And also maybe we can integrate chatbot for symptom tracking, triad, and personalized management in adolescent and young adult colorectal cancer survival. I think about this and I will talk with my mentor again. So I think about the AI about the chatbot to integrate for symptom tracking as well. So I will plan about the smart CRC that for the background and significant for the colorectal cancer that we already talked about in the adolescent and young adult is rising globally. And then for the experience, persistent symptoms such as neuropathy, fatigue, bowel dysfunction, anxiety, and pain, and significantly affect their quality of life. And all of symptoms often go under report and under treat between critical visit due to the gap in communication, limit critical time, and inadequate digital infrastructure for continued monitoring, and digital health technology, particularly AI-powered chatbot, offer an opportunity to bridge the gap by providing real-time patient-driven symptom tracking and triage. And research protocol is aimed to develop an AI chatbot for AYA's colorectal cancer survival that enable daily symptom tracking, severity-based triage, and delivery of personalized guideline informed recommendation. And we will evaluate the chatbot usability, acceptability, and preliminary impact on symptom burden and care engagement in 4-week pilot in AYA CRC survival, and then explore about the feasibility and acceptability of integrate the chatbot into the survivorship care workflow through stakeholder interview. That is my plan for the aim, and for this will be the innovation, because I already reviewed about the chatbot. This is the first chatbot target symptom self-management in the group of young adult and adolescent, and combine natural language processing with validate critical triad logic, and integrate behavioral inform and evidence-based self-care recommendation, and use a participatory co-design approach with AYA survival and clinicians. They can have a communication together. By design, about the 3 phase and method study. About the phase, the first phase is like a co-design and chatbot development, and the second phase is usability testing, and the last phase is pilot the feasibility of the study. Okay, and for the chatbot development, I will use about the IR, CRC, survival and oncology provider to do activity, maybe to define about the symptom set and co-design about the workshop together. And then we'll have to develop about the NLP-based chatbot. It's like a natural learning process with triad logic. It's like a two group of the patient in the level of mild, moderate, or the severe, and we will review about the national guideline to evidence-based guideline to do in order to make about the guideline is relate to the national policy. And then for the usability testing, it might be for recruit for the clinic and survival network to interact with chatbot during the simulate symptom report, and maybe test or use the survey for system usability scale, and then we will conduct about the semi-structured interview. And for the outcome that I already planned is like the usability score need to over 70 for the acceptable, and then suggest for the refinement in the next step. And then to pilot about the feasibility of the study for design for 4 weeks, single arm for pre-post study, and participant is around 30 cancer survival that is focused on young and younger adult and adolescent post-treatment or long-term therapy. And procedure is use chatbot daily as need for symptom report, and chatbot delivery triage, manage, advise, and track adherence, severity trend, and health-seeking behavior. That is my plan, and I think it's to measure about the symptom burden by using the validity instrument that worldwide use, and care engagement about the call or visit trigger and psychological distress. We need to know about that is health for the psychological distress or not, and we will survey about the chatbot stratification and use about the usage analytics. Yes. And data analysis, we use quantitative for the descriptive, pretest, pre-post symptom score, correlation between uses outcome, and qualitative. We use the thematic analysis like a general qualitative data analysis of the interview and using arrival and feasibility metric, recruitment, retention, chatbot use, and technical issue. We need to have the ethical consideration is very important. We need to have the IRB approval, parallel to recruitment, informed consent for the all participants, and secure data storage at the normal process for everyone who do about the project. And escalation protocol to severe symptoms in terms of suicidal ideation and urgent bowel symptoms. That is about um, my next plan. And expected outcome, I think, is a validate user-friendly chatbot phototypes, data on symptom trend, unity and self-management adherence, and feasibility insight in the implementation into survivorship care. This is my plan for the next coming year. And for the global user, that after we already develop, we need to maybe sometime we can translate to the other language and to uh, can transfer to the other country, but the key consideration for global user for AI chatbot is symptom management. We need to know about the language or the cultural sensitive communication. Sometimes we need to know about the technology asset or platform compatibility in that group of population, and also for privacy, consent, and data security also, and about the validity and trust and health system integration. Sometimes we need to adapt to the local care pathway via symptom management at the guideline of that country, and then continue to learning and local feedback loop. And we will have a partnership with the local organization of that country. And then after we develop in the AI, we can transfer to use in the other country as well. That is about my presentation today is about the symptom management in the colorectal cancer. That is the end of my presentation. Anything need to give me some recommendation or discussion, please feel free to talk about it. Thank you.
Thank you so much. Oh, that was wonderful. Okay, so as we transition to questions and conversation, we have a relatively small group today, so please feel free to use the chat, the Q&A, or even raise your hand or unmute yourself if you do have questions. While we are waiting to see if there are questions, I actually have one question to get us started here. Oh, so I was really interested in the project that you're going to be starting with the adolescents and young adults for symptom management. And I wondered if you could talk a little more about the triage logic. So you noted that you were going to measure if that was kind of low, moderate, high. Is this to help get people to a healthcare provider? Like if they're experiencing severe symptoms, are they then triage kind of high and connected with a provider? Or can you tell us a little bit more about how that function will work?
Yes, it's like we will use the instruments integrate in the AI for the young adult and adolescents to rate about the score daily. And then we will try to some, and then we can have that is my plan. It's like and then we have the about the warnings or the alarm to the clinicians to know about the symptom is look worsens right now we need to consultations or have a recommendation back to the group of that population is something like that. But for the instrument right now, we under review for about the use of what the instrument we need to fit with uh, the symptom triad for the group of the colorectal cancer. Yes, thank you, Michelle.
Great,
Yes.
thank you. Do we have any questions from the audience?
I have a
Jimmy?
question. Yeah. Swati crop.
Oh,
Um,
Jimmy, you can talk Thai, speak Thai. It's good
um,
pronunciation, yes.
yeah, I'm doing my DNP work in Bangkok at Syriat.
Ah,
So yeah, I'm curious if and I'm sorry if I missed this in the presentation, if you're hoping to take this work back to Thailand and have some implication over there. And then two, I'm curious if you can talk a little bit about your work while you're in Thailand, if you have a specific specialty or practice there, and any large differences you see in between Thai and the US in
okay.
terms of healthcare.
Okay, I understand, Jimmy. Right now I be here with my self-fund. I'm not back to do about this project in Thailand. I will have the collaboration with the school faculty to develop the AI chatbot to do in the United States first, and then if I have a chance to see how it fit enough to Thai population, I will bring this back to my country as well. And right now, in the context of Thailand, right now the symptom management is not well managed too much as we know already, because the patient is not have a chance to communication too much for the clinicians due to the a big amount of the patient in the hospital. Have you have the experience to see the a lot of patient in the hospital in the OPD or something, Jimmy, in Thailand? A lot of patient in the hospital. So the clinicians and nurse professionals don't have enough time to talk more. Everything I think is a good opportunity for me if I have successful in develop about the AI here, and I will bring back to Thailand and to be consideration to do a project in my home as well. But I will do it in the United States first. Okay. Thank you, Jimmy.
ขอบคุณครับ
Good.
Any other questions from our audience? Thank you, Jimmy, for that question.
It's
I
just
oh,
it's
go.
just about my plan. So today is like to share about my idea. It's not have the outcome yet for
Right.
the implication. So it's like I do for the literature review first and try to bring the grab of the knowledge to address in terms of the AI. We, as I'm a nurse professional, we are not experts in the artificial intelligence or maybe for the technology too much. And right now, I try to contact to the e-health. It's like for um, the institute that we can help us in terms of the faculty and staff, and then for the research in the University of Michigan about the network for the artificial intelligence. We will come to collaboration with maybe School of Engineering in the next future.
So yeah, that was actually my question. Oh, is so if many of the people on the call here are graduate students at the University of Michigan that are interested in global health, and they obviously have the nursing expertise, right? Similar to yourself. But I was wondering if you could talk a little more about your research team, right? So you talked about kind of reaching out to the School of Engineering, but how do you find people with the expertise and interest and build a collaboration over time to really blend the AI plus the nursing expertise that you have?
Okay, the first time that I try to find the collaboration in the university, I have to review about the publication in terms of our organization or our university first that someone have already done in the field of the AI in health. And also I will pick up some of the key person and then email to talk about our project. Or the other way is like a contact to the e-health is EHAIL. I can't remember what is abbreviation for the full name of the institute. That is like they will provide about the resources, about the faculty who have done in terms of the technology before, and then we can contact to that person directly and to have a collaboration together. And also for the my area is linked to the Roger Cancer as well, center as well. I will contact to the director of the colorectal center, Dr. John will help a lot about the literature review in this area. So I think it's not scary to be contact to anyone who that you think is expert in this field, and try to challenge yourself to explain your collaboration by using an email, or maybe to talk more about the benefit for the project for the population or something. I think it's the way that I do. And right now I will be contact to the faculty, Dr. Professor Ivo. He is a leader of the AI. And then we have the appointment to talk about how to proceed further about the project in the next coming weeks. Yes.
Great. Yeah, I think it's really reaching out, right, to the based on the expertise that you need and building the collaboration and project over time, which it sounds like you are definitely doing. Ibrahim, do you have a question?
Yeah, Prof. Good afternoon.
Good
I'm
afternoon. From where? From where, Ibrahim? Where are you from?
I'm from Ghana.
Oh, nice to meet you.
Nice meeting my big professors and the impact you are having for us. In fact, since the beginning of this presentation up till now, the global presentation up to this coffee presentation, I have learned a lot. Yeah, most especially last week presentation and one of the presentation as a global health summit, which was the intimate partner violence, the one who presented in it. Actually, I'm very, very interested in it because it's one of the novel area one can explore in Africa, more specifically Ghana, and to be more specific, in the northern part of Ghana. Yeah, yeah, when you explore in it in northern part of Ghana, mostly in Tamale, you get to know that we still lag behind in certain dynamics in our health. But I'm coming to talk on this, your presentation on the AI incorporation in health. Yeah, I think there is one of my supervisor back at my undergrad who is working on AI at University of Health and Allied Sciences in Ghana here. He's working on AI. How can AI help and to educate patients to adhere, most especially the chronic cases, to adhere to their medication?
Mm.
Because most time we don't actually have time for health education, because most time educating patient on their medication prior to discharge, educating patient on medication and on as they are still in the hospital due to the number of patient, the nurse patient ratio is high, so nurses actually doesn't have time to educate patient more on their medication. So if this one is incorporated in our e-health, I think patient who can read and write, they will have more access to go about their medication. If they need any clarification and justification, actually they can contact a nurse. The health education will be very easy because the person has already established the basis for him or herself. So the person is ready and whatever you are going to say and even give you more of his thoughts on that aspect. I think this is a good area and I must commend you for that. I think this thing can be spread to Ghana, most especially northern part of the Ghana. At least we can benefit out of it. Thank you, Prof.
Yes, I think Abraham, I know this problem. So that I already told you about when the key consideration is like we need to know about the general of the population over there use that uh what platform they prefer to use. For example, maybe in Thailand, people lots of people 100% people have a Line application. For example, we can use the Line for the application or track something from that platform. That is very challenge for the different group of the population in terms of how we can select the good match of e-health for that population about the adherence of the platform for the people to use is for example in the elderly people might be different from the young adult. For example, is young adult might be used maybe mobile app. It's very easy. Yes, for example, we need to so in term of the research or the project, we need to co-design, like I already mentioned over there. Is we need to co-design with that group of the population first, what they prefer or what the platform they need to learn from, for example. Yes. Thank you for sharing, Abraham. Thank you.
And Ibrahim, next week we'll actually hear from Joseph Sieka from Liberia, and he's talking about a the WhatsApp platform and using it for triage and referral for maternal health. So kind of building off what you said, figuring out what platform, what technology people are using, and then trying to utilize that to improve health. So the program that Dr. Sieka will speak about, they've actually used it in Liberia, in Bong County, and then in Ghana as well. So I think it will build off O's work very well, kind of thinking about the use of technology for what are becoming relatively common health problems, right? So colon cancer, and then in the next week, really thinking about maternal health complications. But thinking a little bit more about just Ibrahim's comments as well. The other thing I had written down while you were speaking was really thinking about culturally specific symptom relief for colon cancer. Oh, I don't know if I for a minute. Yeah, and how you would incorporate that over time, especially if you did adapt this to Thailand, like Jimmy asked.
Okay, it's like for the cultural, sometimes it's symptom. You mean it's like for example, I will give the example from Thailand, Jimmy. It's for the better understand of everyone. And for example, generally in Thailand, people don't ask help for other people too much. It's like in Thailand, it's term of เกรงใจ, Jimmy. It's like too scary to ask help from the other people. Sometimes it's will be become a barrier to report about the symptom. Sometimes it's been like we have to educate the people first. Please rating your symptom directly in the application. Don't be scared or something like this. This is cultural. And also for the recommendation, sometimes we have about some food that is might be interrupt for the symptom. In terms of the maybe colorectal cancer, we might have about the how I can say it's about the bowel is chain. It's like a dysfunctions, and some people is avoid to eat some meat, or maybe avoid to um, um, eat some fish. That is like to have a belief about that food might be interrupt the symptom or something like this. We need to know about the cultural that's specific to fit for the recommendation with the clinician need to clear about the patient understanding before using this app or something like this. That's meet your point, Michelle. It's like the cultural sensibility on that country that need to know about that. We need to review and to think about what is might be have become a factor that relate to a symptom management in that context. Yes.
Yeah, that's exactly what I was thinking of.
Prof, I want to come in here. Yes, thank you for the opportunity again. At least, as a young nurse in Ghana here, practicing for about 15 years, I know that treating someone is all about making the person to have you don't shy away the person's cultural beliefs, but you need to build on the person's cultural belief so that the person will know that yes, the culture is there, but incorporating the culture with our medical terminologies will actually help. What's the medicine, the orthodox way of treatment will not affect and combining it with the cultural belief. You let the person go about it. Last 3 years, for instance, I admitted one patient in an emergency department I was working. And the patient said, before he will lie on the hospital bed, we need to give him the chance to pour libation. So I asked him, so how would you pour the libation? He said, okay, if we can get water inside a cup, because there is no the cultural things that they use, he can consult the ghost to see whether the ghost would actually allow him to sleep in the hospital calmly or to go home. So with this one, educating the person to understand most of the cultural things will not actually affects or have any effects on the medical treatment, I think that one is good. So we need to, with this one, incorporating the cultural aspect so that the patient will, the people will actually understand the dynamics and the relationship between the orthodox way and the cultural way, things that would actually be in contrast with our orthodox way of treatment, and the cultural way which will not have in contrast with our orthodox way of treatment, things which will be in contra, you educate the patient to know that this thing, you are just doing it, it will help you, but follow this route which will help you. We are not telling you not to just throw your culture away, but things that would actually help you follow it, things that will have in contra with our orthodox way of treatment, you do away with it as the treatment is commencing. It is very good because as we know that in treatment, psychological treatment is 50%, and the rest of the treatment is all what we do. Because if you can, some patients come to the hospital, actually, they don't need medication. It is due to their mindset. When you counsel the person will calm down, and your treatment will be 100%. In you see that the person treatment will be recovery will be very rapid. So I think educating the patient on their culture is very essential. When you can, if you can incorporate it inside, that is my addition I have for you. Thank you.
Okay. Thank you.
Any other questions for O about her work related to colorectal cancer, palliative care, building collaborations, where she's headed in the future?
Jimmy, Jimmy, have you done about your field work already?
So much like you, I've just finished the literature review. Now I'm working on the implementation framework, uh,
Mm-hmm.
and working closely with my collaborators in Thailand, kind of doing that fine, stakeholder stuff and working out those, details about the cultural competencies and things like that. So hopefully I'll be traveling in the late fall, November, and implementing then. But
Okay.
yeah.
If you have something for me to help you in terms of the
Yeah, I would love,
implementation,
I don't know if you saw my direct
Jimmy,
message, but I was wondering if you could leave your email in the chat and
okay.
I'd love to reach out and talk about, just some
Yes,
stuff
I
about
will help
Thailand.
you about the context of everything. Yes, thank
Oh,
you.
that'd be great. Thank you.
Okay, yes.
Thank you, for agreeing to connect with Jimmy. We actually didn't plan it, but we have a speaker every coffee and conversation who is working in a country that one of our students is. So it's been really nice for the students to hear a little bit more and make connections as well. So we appreciate
Yes.
both your willingness to present today and then to connect with students or others that might have questions after the presentation. It looks like questions are done. So we might give everyone a couple minutes back in their day. But I did just want to highlight this is our second coffee and conversations out of the series. So we have two more left. When we were talking earlier, I gave a heads up. So next week will be Dr. Joseph Sieka from Liberia talking about it's called MOORS. And it is a WhatsApp referral and triage service that they are using in Liberia for maternal health complications. And then on June 17th, we will end with Abigail, who I think is actually on today, and Judith talking about cognitive behavioral therapy for sickle cell disease, pain management in Ghana. And so there have been a couple of projects actually that have looked at the use of cognitive behavioral therapy, again, specifically thinking about that young adult population. Oh, so as they're starting to manage their health, how can they control pain management when they have sickle cell? So a couple more very exciting presentations. If you are here today, then you already registered. So you likely already registered for those. I know Jen has been sending reminders through Zoom on Monday. So on Monday, you'll usually see that Zoom link pop into your email if you need to find that again. And then we'll also continue to record these. So if there are any questions or if you miss a presentation that you had hoped to attend, please reach out to me and we're happy to share those recordings. Thank you everyone again for joining. Thank you, O, for your time, sharing your expertise. And we're really excited you'll be working with us another year at the School of Nursing.
Okay, yes.
And I hope everybody has a wonderful day and we'll see you next week.
Okay.
Thanks,
Thank you.
everyone.
Thank you,
Thank
everyone. See
you.
you.
Thank you.